Well, we've known for many decades that radiation is an effective treatment against cancer. And for many, many years, we imagined that the way that it worked was simply by killing cancer cells. More recently, what we've begun to understand actually is that radiation is able to kill cancer cells in such a way that it may be able to activate immune responses against the cancer. And certainly from animal studies, we've begun to see that actually if you don't have an intact immune system that functions well, radiation is unable to cure cancer. So in fact, we're having to rethink our approach to radiation, and we're having to begin to view radiation as part of the immunotherapy spectrum of treatments. And so what my talk will focus on is really the data from preclinical and now emerging clinical studies that shows actually that radiation is able to induce profound anti-tumor immune responses. And of course, there's great interest in how we can exploit that for maximum benefit for patients. In particular, what we think about when we look at radiation responses is the observation that we've seen in the clinic that when you irradiate one tumor, sometimes you see another tumor outside the radiation field go away. And in animal studies, we've begun to understand that that is mediated by anti-tumor immunity through T cells, which are capable of being activated by the first irradiation event, and those T cells can then go and attack the other tumor and lead to clearance of that tumor. We now understand, in fact, that if we add in different drugs, for instance, some of the new immuno-oncology agents, that we may be able to make that event, the so-called abscopal response, occur more often. Because in fact, most people would recognize that they see that event once every few years in their patients. What we need to do is to use the new drugs that we're developing to treat different types of cancer with immunotherapy, combine those with radiation and or chemotherapy to try to make that abscopal effect happen more often than not, so that it's not once every few years, but it's every day, every week we see a patient who will generate those responses. And that's what I will focus on.